Happy New Month to you all, dear televiewers and listeners of Equinoxe Radio. Thank you for joining us on this other edition of the program Uni Health at an Equinoxe Radio Multimedia. Representation, I am Immaculate Fogwe. Today, we are going to be talking about convulsions, also known as seizures, which is very terrifying for parents who continuously see their babies or young children suffering from this condition. According to the National Institute of Neurological Disorders and Stroke, when a baby is having a seizure, it is important for parents to keep them away from any objects that could reduce the risk of injury. But all of this and more will be explained after this short break. Let's go on this short break. Welcome back. With me in the studio is Dr. Glory Befeke Epuz Anye. She is a general practitioner at the St. John's Memorial Clinic, Susa, and equally right here in Douala. It is a pleasure having you in the studio once more, Doctor.
Thank you, Immaculate. Thank you.
Today we'll be talking about convulsions, which equally referred to as seizures. What is it all about?
Right. Convulsions, these are uncontrolled jerky, twitching movements of the muscles. When this happens, depending on the cause, there are several signs or symptoms that can be observed in a baby. I think we are going to explore more on that.
Yeah, exactly. You were talking about the signs. How does it manifest with babies?
Right. Convulsions, you have febrile convulsions or afebrile convulsions. In babies, that's from 6 months to like 3 years or 5 years. Mostly you find febrile convulsions. Febrile means high temperature in children. So when a child of maybe 6 months to like 5 years is attacked by this crisis, the first observation will be the eyes. You observe the eyes, you find the eyes rolling upwards towards the head. Sometimes you may find the mouth foaming. Sometimes you find the child unconscious. Normally the child will go unconscious. Equally, you find this twitching, these jerky movements of the arms and of the legs. Sometimes you find the whole body equally jerking and twitching. Sometimes you may find just some parts of the body. So there are several of those signs that when you start observing in your baby, you should really take care and pay attention. Sometimes it comes with cries, some sharp cries at the beginning of it.
So doctor, can an elderly person equally suffer from convulsion?
Right. There are several diseases that can manifest with convulsions. Convulsions is like a sign that you can see. For instance, epilepsy.
Okay.
Yeah, epilepsy in the adults can be manifested. One of the signs is convulsions. Although we have patients with epilepsy without this generalized or tonic-clonic jerking, twitching body movements, you may have maybe epilepsy with signs of confusion and not necessarily convulsion. So in the elderly, they also convulse, especially those with epilepsy.
Since we are focusing on the children, I want you to tell us, what are the major causes of convulsions when it comes to babies?
Right. First, we talk about the febrile convulsions.
Yeah.
Now, fever. When there's a spike in high temperature, you always have a child running into convulsions. Parents need really to be aware of that. When the temperature starts running above 38, right up to 40, they should pay attention, take off dresses from the child. Equally, for the babies, you can have the cause right from the perinatal period. You see some of the men who use their wives like the punching bags. When they are pregnant and you punch your wife maybe on the abdomen, you don't know which position you're hitting on. If you hit the head, then as a child comes out and is developing, that may affect the child's neurological development, and the child may start convulsing at a very young age. So you have fever, you have maybe perinatal signs, you have infections, meningitis, encephalitis. Encephalitis means inflammation of the meninges, something found in the spinal cord. So also you may have low blood sodium. There, when we do some blood tests, we may find that also low blood sugar level, and in some cases high blood sugar level can equally cause that. Well, alcohol, we cannot really associate it with children. Maybe alcohol abuse, yes. Drugs as well, some medications as well, we can equally have them in children. But majority causes of convulsions in children aged 6 months to maybe below 5 years, we mostly have high temperature, fever, infections.
You are a medical practitioner, and I guess you have worked with several cases of convulsions at the St. John's Hospital. So now, tell us, when a case like this comes to you, in most cases, what is the major reason that triggers convulsions with the cases of Cameroonian babies? Do you know a major issue?
Right. Fever caused by malaria.
Yes.
Because we are in an endemic tropical malaria-infested zone. So majority of the cause, one of it, we have malaria, especially Plasmodium falciparum. So in our hospital at the St. John's Memorial Clinic at the Elf Non-Glacé, when we receive such a case, first we want to manage the crisis. We want to take away the child from such a crisis. Then we settle down to check out the cause. What is all about it?
Yeah.
Yes, because we treat according to the cause.
Okay.
So if we realize that it's malaria, we treat the malaria. If we realize that it's an other infection, maybe we do a lumbar tap. We realize maybe the kind of germ found maybe in the meninges, we treat. So it all depends what cause, what is at the back of that convulsion.
You said your hospital treats according to the cause. Okay, let's say a case where a woman experienced violence. How is it being treated?
Right. In that kind of case, when the baby is born, the convulsions will come in an afebrile manner. You hardly find the child manifesting with a high temperature. So when the mother comes, there we run, after running the biological test, and we seem not to see any reason, only the results all maybe come back negative. What we do, we can order for a scan and to treat the baby.
Okay, if you're just joining us, then know you're watching the program You're in Your Health, and we are talking about convulsions and seizures in babies and, of course, young children. And that is being done with Dr. Glory Befeke Epouse Anye. Back to you, Doctor. I want us now to talk, is convulsion dangerous?
Yeah, convulsion is very, very dangerous. But given that we are in an endemic infested malaria zone, high temperature, convulsion, first to say, is one of the signs of a severity for severe malaria, okay. Criteria for severe malaria. So sometimes when the babies are hit with this convulsion, we always signal that, oh, there's a severe malaria. So that may happen just once. But if the child keeps having some repeated convulsions, there is a cause of concern. Okay. Now we'll have to explore deeper to see what really is the cause in this situation. Yeah.
To participate in the programs, our technician will be displaying the contacts on the screen so you can call and participate in the program. So very soon we'll be displaying those numbers for you to call. And to participate, you can call the number 655-51-1111 or 652-025050. Those are the two numbers which you can use and ask your questions in the course of the program. So, Doctor,
yes,
maybe let's take a case in the far north region where we know hospitals are very far away from the rural areas, some rural areas, of course. And imagine me being a mother. I have a child who is suffering from a convulsion and the hospital is quite far. What is the first step I'm supposed to take?
Right. When you observe any maybe unconsciousness in your baby, you observe any of these signs, maybe foamy.
We have a call on the line. We'll come back. Hello? Hello? We just lost that caller. So we're talking about what to do.
Yeah. So
okay, the caller is back. Hello? Not back? Okay. Sorry.
So what the mother should do in this situation is, first you have to get the child, be sure that the head, the neck of the child is free. Maybe if there was a tie on the neck of the child, you loosen it up. And second thing you do is to place the baby on a sideways position on its side. You don't leave the baby lying downwards on the back, no, but at the side. And if the baby is vomiting, you try to take off any liquid from the baby's mouth. So you don't put nothing in the baby's mouth. You don't rush the baby maybe to a latrine, because what we observe in most rural areas and some cases that come to us, their first aid that they give at home is they turn the baby's head into the latrine.
Exactly.
Yes. Some even allow expose the baby to inhale some odor, toxic odor, maybe from burnt dresses. Another one, the cotton issue.
Yes,
they
cotton and
spirit. So all these practices are very dangerous to the brain, very, very dangerous. The first thing to do is to clear off the baby's throat or head and neck to be sure that it's free. Second, we place the baby on the sideways position, maybe the left by the side. And if you observe that the baby, now you also time, you should keep a watch, because that should happen within 5 minutes. You should expect that the seizures should cease. So within this period, if the seizures are not ceasing, you should rush with the baby to the hospital. So avoid putting the baby maybe in water. That's what most people will do. You should not put the baby in water. Now, it's very dangerous to put the baby's head upside down into the latrine, because in the event where the crisis of these convulsions are being experienced by the babies or a baby, the airway gets obstructed.
Oh, la, la.
Now, when you do that, what do? You help to suffocate that baby, and it's very risky. Equally, the heartbeat increases. We have what we call arrhythmias, and that can even lead to a cardiac arrest. So the best first aid we can give at home is to do some of these things. You time, and in the event where you are having some repeated convulsions, you rush to the hospital.
Even if the timing is right, as you said, 5 minutes, it should not exceed 5 minutes. Is it still necessary to take the child, maybe if the child is back, to the hospital?
Right. After the seizures are over, it is advisable, even if it's just the first episode, it's advisable for mothers to take their babies to the hospital for check. They have to check to see the cause. Could it be an infection? What cause? Now, epilepsy may start manifesting at such a young age, because at that age we don't talk about epilepsy unless maybe we have like from 2 seizures and above, which becomes chronic. Now, the mother, it's necessary for the mother to carry this baby to the hospital for all these checks, so that we should know, establish right from the early onset what the cause is. So early management will be good for the baby.
And is convulsion treatable?
Yeah, convulsion is treatable according to the cause. Now, repeated convulsion, that probably if you do something like an electroencephalogram, is a test to check the electrical activity of the brain nervous cells to see if this is an epilepsy or not. So epilepsy, if it's an epilepsy, it's managed, it's not treatable. The convulsions, maybe from infections, from a malaria, is treatable.
How can we prevent such a situation from happening?
So we prevent such a situation from happening by carrying our babies for frequent checks, the healthcare professionals. And if the baby is, maybe the temperature is spiking, you take off the baby's clothing. And also feeding the baby properly, the vegetables, fruits, and
avoiding
to load the baby with a lot of, last week we were talking about the sugar level and
diabetes, exactly.
Diabetes. Avoiding to load the baby with all this sugary stuff, because high glycemic level may also lead to that. And also reducing the salt intake. Reducing does not mean you prevent the child from the salt, but avoiding that there shouldn't be an excess, because when we have equally excesses of all those minerals, it can lead to convulsions.
For parents who are going through such hard times or are seeing their children in such a situations, what advice do you have for them watching now?
Right. For parents who maybe are struggling to manage fits or seizures of their children, regular checks are very important. If your baby is already diagnosed of epilepsy, make sure the medications should be respected strictly, because if the medications are respected strictly, this crisis will reduce.
And how much does it cost to treat someone suffering from such a situation, let's say baby, in your hospital?
Right. Depending on the cause, if it's a malaria, I think the price will be really less. But if we do a test and the malaria is negative, maybe we do a lumbar puncture and maybe it's okay, you have to start doing a scan. You see, those scan is hundreds of that. So depending on the cause of the convulsions.
Okay.
Yes.
And that's where we end this edition of the program You and Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe, and I received technical assistance from Ephraim Yemeli. And for my guest, that was Dr. Glory Befeke Epuzu Anye. Have a lovely day in the company of more programs on Equinoxe Radio and television. Don't forget, your health does not have a price.